and I'm pleased Mel Robinson is going to be keeping the panel in check and is going to be joined by Rebecca Davey from Grams, Lee Strachan from SWAMS, Christina Hunn from PAMS, and Eden Coyne from WAC's Great Southern Aboriginal Health Service. And hopefully this will explore ear and hearing health models of care across WA with a focus on the service delivery model, impact on communities, and successful strategies and current challenges. So thank you, Mel.
Great, thanks, Peter. If the panel are happy to come up, that would be great. I'm just going to change it up a little bit and make this more of a yarn. So if you've got questions, please interrupt us. But we're all going to sit and have a yarn now about, what's going on and showcase some of the amazing work that's happening. You got one? So I'm going to sit down with the panel, but I think first off, it'd be great if you could introduce yourself, a little bit about who you are, where you come from, that sort of thing. Yeah.
Hello everyone, my name's Eden Coyne. I am a Menang woman from the Great Southern. I work I coordinate the eHealth program down in Albany.
Hi everyone, I'm Leah. I work for SWAMS. I'm a child health nurse and coordinate specialist clinics within SWAMS for our children. So coordinating ENT clinics, paediatric clinics, and overseeing other children with chronic conditions. I worked in the Pilbara for 8.5 years, so that was a lot of my background, and grew up in the wheat belt, so had a lot of country sort of upbringing.
Hi, I'm Christina. I'm from PAMS up in the Pilbara. Been there for 2 years, Director of Clinical Services. Previous to that, I've worked across the country in a lot of remote areas as a remote area nurse.
Hi everybody, my name's Beck, a child health nurse at the Geraldton AMS, Grams, and I've been there since 2016.
So we've got some questions that we're going to ask the panel. We've only got one microphone, so we're going to be flexible here. So I think, really important to start up with this question around, can you share with us your ear health service and how it's being delivered in your community? And anyone can answer this, or you can all answer it. We do really want to hear from you how things are going out there, and yeah.
Okay, so our eHealth program, we go out to our schools and screen our kids age pre-primary to year 1. We also have a Rural Health West funded visiting ENT, Dr. Francis Lanigan, that comes down and visits us 3 to 4 times during the year. And we have our local audiologist, Claire Trainer, that is also funded by Rural Health West, that does our audiology clinics.
So our ear health service at present stands, we have funding from Rural Health West for 4 ENT clinics per year. We have Dr. Lateef Kadim visiting for those. And alongside that, we also have an audiologist, paediatric audiologist, that attends the same day. Alongside that, we also have Happy providing audiology every month. They visit 3 to 4 different services of SWAMS in that week. So they have Bunbury, Eton, Busselton and Collie. Then from there, we also work closely with WAC's CDS services in Bunbury. So they obviously get referrals from other areas that may not be SWAMS referrals, but also our clients. So they offer their services within our buildings for comfort and access of care for clients. They come monthly depending on need, which they provide physio, speech and OT within our maternal child health building. We also have GPs on site which complete ear health checks during all 715 health checks, and all of our child health nurses are trained in ear health to do complete ear health checks during child health checks. There's also a WAC's CDS have started an ENT specialist clinic, so at present, once Lateef's finished with us, he heads over to WAC's and completes the specialist clinic there. That's specifically around vulnerable families. Some of those kids are from our clients, so we assist with transport to sort of decrease non-attendance and ensure clients are comfortable. We can have people attend with them. We sometimes will use Hudson Road, which is the CDS service, for our younger clients because they have the audiology booth there. But once we get our new health hub up and built, we will have our own audiology booth.
Hi, so we have regular ENT surgeon visits funded by Rural Health West. We actually have one in Jigalong, one of our remote communities today, with the surgeon and the staff from Ear Science, the audiologists from Ear Science, who also had a great day in Newman yesterday, had a health promotion event and saw 60 children in one afternoon. We also have Hearing Australia and earbus visits to the schools. And our child health nurses and our GPs are trained, and we have the video otoscopes and regular telehealth ENT appointments.
So we're quite lucky at Grams. We've got the family health unit, which sits alongside our main GP clinic. In that unit, we've got child health nurses, speech pathologists, OTs, GPs, midwives, visiting paediatricians. We've also then been funded Rural Health West for audiology, and we've got our Happy program as well. So the GPs can refer into both of those programs and get kids and adults seen reasonably quickly. We don't have any. Well, we've got private ENT services at the moment, which our families are being referred into, but there is a cost associated with that. We do work closely with our child development services, and we sort of do try to cover the costs where we can as well for our families. I think that's about it. Yeah.
Right. I think it's good to hear all the work that's happening in your different regions, and a lot of that is based on collaboration and partnership, which leads to the next question. And I think Leah, you talked a little bit about working with WACS and CDS and that, but I wonder if others have got examples, and you might have other examples of where you collaborate and partner with other agencies, because obviously what we need to do is join up together around this stuff. Yeah.
We work alongside our child development services as well. We're trying to get out to our playgroups, more getting out there to the community. We've been working closely with the schools, the AEIOs. That really helps us as well, because they know the kids and the families, and
Thank you. So we take referrals from, we get them from the earbus and telephone speech and hearing from school visits, and obviously earbus goes out to Narrogin as well. So we do get referrals from there. We have a SWAMS service in outreach service in Narrogin. So it can be a bit tricky for us to get our clients in for specialist appointments, but we do offer transport, which really helps. We also work alongside Bunbury ENT, which is a private ENT in Bunbury. That's Rohanna O'Connell and Frances Lanigan. And they perform the surgeries at Bunbury Hospital through the public waitlist system at Bunbury. And then they get flicked back to SWAMS for follow-up audiology and GP check and follow-up with Latif in our ENT clinic. So it's been a bit of a transition process, as Latif used to perform the surgeries in Bunbury, so that was quite seamless in that he would see them with us, and then they'd get put on wait lists and he would perform surgeries. But it seems to be going quite well at the moment. Latif does not do surgery in Bunbury at the moment, but we'll do complex ones. If we have a list of complex clients, he will try and make a day to come down and do them. We also work alongside the paediatric ward at Bunbury as well. If we've got clients going in for surgery, we'll have people go in and support families if they need it. We have our little ENT bags that we give families that are going for surgery from Aqua. And yeah, there is a lot of schools around, obviously, in the southwest, but they all are very willing to contact us if they need anything.
Yeah, so we have a great service in collaboration with Ear Science. So they do regular remote charter visits, charter a plane to go out to our 4 remote clinics a few times a year. We also have a good relationship with the day surgery team up at Port Hedland, and Dr. Anton does a list just for our patients on a regular basis. So I think stakeholder engagement provides success for better health outcomes.
So we partner with, I think we do, one thing we do really well with is linking in with other organisations to track down kids who might need surgery, who have been missed and that sort of thing, and we can send out our teams to track them down and look at barriers as to why they might have been missing from these services and that sort of thing. We also work closely with Aqua, and we've got lots of resources from them as well, so just educating the families about the importance of ear health. What else was I going to say? I guess the other organisations, we work closely with our schools as well, so any of our clients and families that the schools are worried about, we get them straight in, get them referred. I think, we could look at, we've got a GP clinic that runs in one of our local schools, and it would be good if we could sort of coordinate the 715s and the ear health checks in with that service as well. So maybe that's something to look at in the future.
And Mel, I would just like to add that we have also sent some of our kids haven't been able to have their surgeries done in Albany, so we've referred and Chloe's team at the Cobar Integrated has helped us in getting some of our kids their surgeries done up here in Perth, and we also have Katanning Hospital offer if we've got kids that need surgery done and they don't want to come to Perth. Katanning's just a town that's an hour or two away from us, and they've helped us also get those kids some surgery. Yeah.
And I think there's great examples in there of how you are working together to create kind of a holistic model, I guess, to ear and hearing services, which is really important. And I know there's probably lots of other examples in this room as well. The next question is about technology and, the importance of technology in the ear and I guess hearing health space, particularly now, but also going into the future as well. And I think last year we saw the ear telehealth stuff, which was pretty amazing, where we looked in someone's ears in one of the PAMS clinics. But, do you see technology as something we could get better at and utilise more? And you're probably already using technology now.
Yeah, so we use technology, but it's with saying that, the training, having Aqua come down and train us to use this equipment has been great, and having Sonic Innovations give us equipment that we can use to screen our kids. We also have that option where we can have a video otoscopy where, not only are we seeing what's in their ear, but the families can see what's going on as well. And I think that's really great to have. And also, if you want to get someone to have a look and think, oh well, I think that this is what's going on. You've got that picture there as well. So yeah, it'd be great to see more stuff happening.
Yeah, we've got obviously all the equipment that we use for our ENT clinics, which Latif brings some of his own down as well. We've just recently purchased another audiometer for paediatric audiology, through Sonic and funded by WA Health, which we will be using next week in our clinic. Our audiologist Lydia Lee from PCH will be doing that. Latif also offers telehealth follow-up, so if he sees clients within our clinic who may need to have some imaging done or may need to have some other testing done, he offers a telehealth service to review them prior to consenting for surgery and things like that, which is good because it just means that frees up another appointment at our next clinic that is a 5-minute follow-up that he can do. But yes, I think technology definitely has a big impact on ear health. Yeah, and we've also just had our video otoscopy programs all uploaded to our computers for our child health nurses to use, take photos of, and consent to GPs within our service for review.
Yep, similar to the other two. We have the video otoscopes, which helps us with the telehealth with the surgeons. I think one thing we need to look into is probably newborn hearing screening, because a lot of our mums have to go for at least a month beforehand to Port Hedland or Perth for sit down. They get discharged very quickly and they want to return to country, so I think a lot of those may miss out on that newborn screening. So if there's something we can get up in our area so they can access that.
We use the video otoscopy and the pictures and everything. We've got a bone conductor hearing machine as well. It's state of the art, and that's all I know about it. But it just it allows our audiologists to do amazing things, and we do what we can on site, and then refer out where we need to. I guess in terms, one difficulty we are having with technology is that the central referral system is only accepting fax referrals at the moment, and it does pose a huge barrier for us in the country because our fax machine doesn't always work, and they don't accept emails. So, it's a bit hard, time consuming. So.
I didn't even know anyone still had a fax machine anyway. That's how far behind. I'm going to look into that. Great, thank you. And, it's not easy to be up here on a panel, and you guys are doing a really great job. So we're down to our last question. You'll be glad to know. And then we're going to open it up to the floor, I think, to, anyone wants to share their story or ask a question of the panel. So last question is really around, how does your service make ear and hearing services accessible and centred on families? Because we know that's really important, and broader than families, the community as well. So, what do you do, or is there any tricks you can share around how you bring families in and, make sure that it is done in a way where they're part of it as well?
So for us, we have a transport service, so for those families that don't have their own car, we have that. We also know the families, so it's not like we know certain things that are going on, or where we might find them, or we're pretty flexible in that way. Like we also have like other places, so Aboriginal health might suit some families, but then other families prefer somewhere else, so we're able to make that accessible for them as well. I think that putting that family at the centre of what we do is what it's all about, really.
Thank you. So we again also have access to transport services, whether that be to our SWAMS clinic or to Hudson Road for CDS services or to the hospital for surgery. Also our outreach services, we can provide assistance with transport with those as well. We have some clients coming from Narrogin Way for ENT clinics, which we can provide transport. We also have, obviously there's no cost with our service associated with ENT. There's also, often I'll call a mum or guardian or carer to book in a child for our ENT clinic, and they may mention that they've got another child that's got hearing loss, or the school said something to them, or they've had an ear infection. Quite easy that I've got access to book GP appointments, so I could say, let's bring the child in, the GP can have a look. If they feel they need a referral, we'll get that sorted, and we do try and accommodate sibling booking. So if mum's bringing one child in, we will squeeze the sibling in with them. And Lettice's very accommodating with that as well. Also collaboration with other family services such as school, daycares, child development services and other GPs that may want to refer in. That's kind of how we keep it family orientated, to make sure that we can have access for all members of the family.
So we also collaborate regularly with the schools and bring the families in for those days as well. We have regular health promotion days, which is facilitated with our ear health coordinator from Ear Science, Lucy Mitchell. So she comes up to the Pilbara often to do those days. Even in our NAIDOC week celebrations, she took time out to come out, and families got involved with the video otoscopes to see what was inside ears, and just started that conversation. So each time we have a health promotion day, we see more and more families interacting. And just with Rural Health West funding, with the fast track surgery trip that I presented on yesterday from Jigalong to Port Hedland, which saw a quicker turnaround, flying up one day, surgery the next, and then flying back to community. Otherwise, there's a bus once a week from Newman, and then PATS don't cover a lot of their accommodation for the rest of the week that they're up in Port Hedland. So just getting that done through Rural Health West and Ear Science was a great initiative. And we have, Ear Science has gotten some funding from BHP to facilitate 2 trips a year for the next 3 years. So
our families, so I guess we're in a regional town, and we do rely on all of our networks to work with the families. And when the families have time and are ready, then we go and bend backwards and get them in and see what they need done, basically. We've got a really nice campaign running at the moment where we've got one of our local mums with her children, and we've videoed them getting ear checks, and now we're seeing really good outcomes for those kids, and it's been really nice actually. So she's sort of like our poster mum, and she's really well known within the local community as well. And just breaking down the barriers, we've got transport, take them to their specialist appointments and that sort of thing if they're local. We rely on PATS funding for our families as well, and that is quite limited, as we know. So we do try to do what we can with what we've got within our means to support them. But families is everything. And we've got a few cases where the family haven't acknowledged that there may be a problem with their child's hearing, so you've just got to hold ground basically and wait till they're ready as well.
I think there's some great examples in there of how to do this, and I think lots of you know this stuff as well. Any questions for the panel? Because we have got a little bit of time now, so happy if anyone wants to make a comment or ask a question. Otherwise you're going to lunch early. No questions, wow. Oh, hang on, here we go. See?
we heard this morning about issues in the metro area with wait lists. Is that an issue for you guys? It seemed you're fairly coordinated, and is that organised, or am I overselling that?
We don't seem to have the big waste lists like you do in the metro. I don't know what the reason for that is, but we probably don't have the population that the metro area has either.
We've been pretty lucky so far. Ours obviously all goes through Bunbury ENT, but most of our children that have been seen, we had a clinic in May and they've all been given surgery days from November or earlier, which has been really good, and it's been very similar throughout the year. So I haven't really come across none that have gone over wait time so far.
Yeah, we're a bit the same. The ones that we have had have either been seen or they have got surgery dates. So it's been great.
Hi, I just wanted to say how valuable, from someone who's working in the city, in the metropolitan area, how valuable having you guys out in those communities, because we wouldn't be able to do our work. You know your families, you know how it all works, and you can guide us. So, you know, just the example with Eden, with those kids that came up, you know, it was just wonderful having you there, and knowing, and all of you knowing your families, and how we can, it's just, you can't put a price on it, having you guys out there.
Sorry, I'm just going to say our biggest gap, and I'm sure it's for other AMSs as well, is that we have no ENT. We do have a private ENT that is in Geraldton, but out through the Murchison. We do have rural health funding to go out there, but we're struggling with an ENT at the minute to be able to do that trip. And that comes down to resources as well. But within Geraldton, and we do refer into Coburn and into PCH, but then it's the time that the families have to be away for the tonsils for 2 weeks, and it's just way too much. If we could have a service within Geraldton and make that a hub, like Port Hedland, and have a visiting ENT, that would just absolutely break down so many barriers and get these kids seen and the families seen, but staying on country. And we could get the Murchison kids in. We can also get Carnarvon kids in as well. So if anyone knows an ENT that would love to come to Geraldton, that would just be absolutely fantastic, and it would really add to the service that we're trying to do with our great partners with Hearing Australia, with Anna Maravich as well. That would be wonderful.
I just have to agree with what June was saying as well. You know, it's great to have you guys out there. So that's why I hide behind you. Yeah, you're the bosses, basically. Just to add as well to what Maggie was saying, I understand, because we were supposed to have ASON's representatives to come in and have a talk about the mapping of the ENTs around the nation. And unfortunately, we're going to have to actually look at that at another time to do so. And it would be interesting to see what's actually happening with that mapping of the ENTs, you know, for around all of the nation. So let's see what comes about for that one. So, yeah, I just thought I'd add that in.
I was just going to add in, and I know how complex it is as well, because then it's not only the ENT, but it's the staff that need to help support within the hospitals as well, to be able to then care for the children post-operatively. So I know it's a massive big task, and we do have great partnership with WACS as well, with the local, so we'll be teaming up with WACS to see what we can do collectively as well.
Yep. Wow. You guys are amazing. Can you please join me in thanking the panel